benign prostatic hyperplasia, or BPH. So we're just going to cover the pharmacology for it. Here's just a little picture talking about an abnormal prostate. We're focusing right here on the hyperplasia. Most common benign tumor in men, obstructive or irritant voiding symptoms. So I stuck this in here because we're going to be talking about alpha blockers. So this is from your previous thing on your sympathetic nervous system. We talked about beta. We'll be talking more about beta when we get to the lungs. And now we're going to talk about our alpha receptors. So if you look here, alpha 1 receptors. If you remember on your alpha 2 receptors, when it regulates, moderate insulin release, some of your anti-diabetic drugs for type 2 diabetes work there. Anyway, we're on the alpha 1 receptors. So the alpha 1 receptors dilate people's closed bladder, sphincter, vasoconstrict blood vessels. So the drugs we're going to talk about that block this do the opposite action. Here we go, your 5-alpha reductase inhibitors. So they're inhibiting some of those alpha response. Interfere with effects of androgen or male hormones of the prostate, reduce risk of urinary retention and need for surgery. Not effective if prostate is not very enlarged, so it has to be in a very enlarged prostate. Reduces PSA, the protein-specific antigen levels. PSA level is monitored in the blood. Purpose is to keep symptoms from getting worse. So they block the 5-alpha reductase enzyme needed to convert testosterone to dihydrotestosterone, or the male hormone androgens, testosterone. Symptoms do not always correlate with the prostate size, so may not be effective. I have had people with their symptoms, they're getting up 4 or 5 times a night, their difficulty starting and stopping the stream, very symptomatic. Do an exam, and it's not very big, and the prostate PSA is not very high, so this type of medication would not be effective for them. If you notice, I have on here table 5.6 on page 307 of your Pearson text. It has the 5-alpha reductase inhibitors and then the alpha adrenergic, we will talk about it in a minute. So the 2 finasteride and dulasteride. You see the endings, asteride for your alpha reductase inhibitors. Adverse effects are erectile dysfunction, decreased libido, and gynecomastia, which is the breast growth. If you think about it, that's more so on your dutasteride. Finasteride has really no adverse effects. So it would probably is actually the one I prescribe more for that reason. And if you think about what it does, the erectile dysfunction, because of the effects it has on testosterone. Anyway, let's keep going. Patient teaching 6 months before it's effective in shrinking the prostate. And remember, they have to have a very large prostate. And it has to be taken for a lifetime. So this isn't something that you take and it reduces the size and you can stop taking it. It does reduce the size, but it has to be taken continually, because studies show if they stop taking it, it enlarges again. So it reduces it as long as it's taken and blocking that alpha receptor. Do not break, crush, divide, or dissolve. It has to be taken whole. These are patient teachings that I'm likely to come up with questions for. Should not be taken by men planning to father a child because it messes with that testosterone and their fertility. May cause birth defects, and also this may cause birth defects in a male child, and women who are pregnant or might become pregnant should not handle or any of the crushed tablets of finasteride or dutasteride. They cannot get near them. Category X. They can't even touch them. The other class in table 5.6 is your alpha adrenergic blockers. Block the nerve transmission at the receptor site in the bladder. So they work specifically at that alpha receptor in the bladder. And this one is immediate, whereas the other ones take time, like 6 months. This is immediate shrinkage. This class most commonly used for symptomatic relief of BPH. The nerve transmission blocks and relaxes the smooth muscle in the bladder head, but does not interfere with the detrusor muscle needed for bladder contraction. So they can still squeeze out, so they're not going to have urinary retention, but they relax the muscle. So also listed in there, you have alpha-zocin, doxazocin, tamsulosin, zarosocin. And you notice the zocin, even if tamsulosin is different, just think of zocins. And one thing I always remember with the zocins, when you talk about adverse effects in a minute here, amiodarone, casa, doxazocin, or tamsulosin. Let's see. So you see your side effects, postural or orthostatic hypotension, headache, and dizziness for your doxazocin. Your prazosin is very big for your first dose phenomena with severe hypertension, CKD, and tachycardia. I always think of all of these of having that first dose effect of dropping the blood pressure. So tachycardia, orthostatic hypotension, vertigo, and sexual dysfunction. Remember, do not break, crush, dissolve, or divide, especially when it's an extended release. Take the whole tablet. They need to take it the same time every day. Not to take it if they're planning on having children, because it will mess with that. And anybody, woman pregnant, planning to get pregnant, should not get near it because it is a category X. Back to here, your sympathetic response. Remember, your zocins here for your alpha receptor blockers. I don't want you memorizing it. I just want you familiar to help you remember what you need to do. Patient teaching. If taken in XR, do not crush, divide, break, or dissolve. That goes on it's an extended release. It releases over a period of time. Onset of therapeutic effect, that's within 1 week. This is for your zocins, your alpha adrenergic blockers, and remember your 5-alpha reductase inhibitors can take up to 6 months. Recommend taking at bedtime. This is for your alpha adrenergic blockers because of the hypotension. And that is the end. Short and sweet recording.